All right, guys. So today I'm gonna taking you guys through a program that's gonna help with regards to freeing up if you guys are experiencing any tightness with your work setup, or you're noticing some posture related pain or injury as a result of it. I'm gonna be taking you guys through a routine that I've been having a lot of my patients go through that are experiencing a lot of pain as a result of working from home more and having less than ideal uh, ergonomic setup. So I'm going to take you through our posture restoration process and kind of hopefully give you guys some insights into not only about the exercises and how they're going to, and also, but they also explain how they're going to be helpful, and then also give you guys a little bit of background on ergonomics to a certain extent, and explain a lot of the pains that you guys may or may not be experiencing. So the first thing is that we see a lot of as a result of poor posture and poor ergonomics is three things: shoulder pain, especially in the front. So if somebody's slouched over or sitting with poor posture throughout the day, they can get a lot of shoulder impingement, especially if they're doing a lot of workouts where they're doing overhead press, or they're doing overhead or they're doing like snatches, or they're power clean, stuff like that. We see a lot of shoulder impingement or pain in the front. And the reason for that is what I want you guys to do for me real quick is I want you guys to give me your best impression of poor posture. Slouch over as much as you can. And what I want you to do from there is try and raise your arms overhead. What you guys will find is you're not able to go very far overhead. Okay. However, what I want you guys to do is now sit with good posture and do the same thing and see how much further you guys are able to go. Okay. So the thing is, if you're sitting with poor posture throughout the day, you're going to be more prone to have poor extension of that upper spine and the upper back. So it's going to be harder to achieve that overhead position. Okay. So we got to free, a lot of times when somebody's having shoulder pain, they focus on exercises targeting the shoulder. But the thing is, when I corrected my posture, I wasn't actually changing anything at the shoulder joint or changing anything with regards to the muscles or anything like that with regards to the shoulder joint. However, what I was doing was I was changing the spine orientation. I was creating more extension of the mid back. I was creating extension of the lower back and getting into optimal alignment with that. I didn't do anything to the shoulder. So just because you're having shoulder pain doesn't mean that's exactly the root cause of it. And so one thing that I'm going to be doing is actually taking you guys through a routine that's going to help free up your thoracic spine. Your thoracic spine is your mid spine. Okay. And that's the thing that you're changing the most when you're sitting upright, that and your low back. Okay. So we got to start when you're sitting with poor posture, you're in thoracic flexion or mid back flexion. Okay. This is flexion, thoracic flexion. This is thoracic extension. If we spend a whole lot of time here, we need to start opening things up. We got to decrease tightness in the chest, decrease tightness in the mid spine as well. Okay, so I'm going to give you guys some exercises for that. The reason I'm going through this is to explain, and I do this with all of our patients, is explain first of all why you're having pain. Because if you better understand why you're experiencing pain, you'll know how to minimize it and not put yourself in positions that are going to be harmful or be problematic down the road. And on top of that, you're going to also better understand the exercises that I'm going to be providing today as well, which makes you more apt to actually do them, because you're like, oh, I'm not just doing these exercises just because Dr. Ben told me to. I actually understand why they're helping me and how they're helping me. So you guys are going to be more apt to do them as well, okay, and get more benefit out of it by being consistent with it. Okay, so that's usually what we see with up-related shoulder issues, is that shoulder impingement. It's usually not due to anything really at the shoulder joint. It's really due to poor positioning of the spinal segments of the thoracic and low back. Okay, next thing is that we see a lot is low back pain. Okay? And the reason for that is people, what they do is like they're sitting more at their couch and they are hunched over. Okay, again, we've got thoracic flexion and then also flexion of the lumbar spine. So if you guys sit up with good posture and feel your low back, you'll actually see like there's a curvature to the spine. Okay, however, if we sit with poor posture, we just get flexion or rounding at that low back. Okay, so what happens, I'm going to kind of give you guys an anatomical breakdown of the low back so you guys understand if you are having low back pain, what might be going on. Okay, especially if it's posture related. So if we sit with good posture, we have this natural curvature of that low back and that low spine. Okay, however, so this would be what would look like naturally. Okay. However, if we are sitting with bad posture, what happens is we have the rounding out here. Okay. This is the front spine, this is the back. If we're sitting with bad posture, round it out like this. However, good posture is we'd have curvature of the lower spine like this. So we have, on top of that, we have vertebrae that are stacked on top of each other. In between each vertebrae, we have a disc. It's full of fluid. And the vertebrae, or the bone that's stacked on top of it, is solid bone. It's rock solid. The substance for the disc that's in between, I'm sure you guys have heard like disc herniations or people blowing out their back, throwing their back out, or slipping a disc. That's what they're referring to, is that disc being irritated or injured. Okay, and that disc, it's like jelly-like substance. So when it comes to the bone versus the disc, the jelly-like substance, that bone's going to win every time with regards to pushing that disc around and kind of bowling it. So when we have not a good posture and that curvature, that low spine like we're supposed to, that weight of the vertebrae on top of the disc is equally dispersed all the way around. However, if we sit with poor posture and we start rounding out too much, now that front part of that disc starts pushing on that front part of the bottom, on the front part of the disc, and compressing it between the vertebrae on top, being compressed between the vertebrae on top and the vertebrae on bottom. So what happens is when we get that compression, that jelly-like substance has to go somewhere when it gets pinched. It's going to get pushed back, okay? And that can cause pain. And on top of that, people, if it's bad enough, will start having pain down the back of their leg. Because the reason for that is there's nerves that exit the back of the spine. So when that disc gets pushed on the front and starts getting compressed and pushed towards the back, it can hit nerves that are passing out from the back of the spine, okay, and cause zinging and pain and numbness and tingling down into the glutes, down into the legs, and sometimes in really bad scenarios, down all the way into the foot. Okay, so you guys are probably like wondering, like, well, how do you fix that? Well, first of all, it is changing your posture, making sure you're not sitting all day with a slouch position. However, what we need to do is, instead of getting that flexion, we need to get extension. So we're pushing on the back part of that disc and pushing it back forward where it needs to be. Okay. So I'll be going over some exercises to correct that. So that's low back, cover the shoulder and low back. And then that next thing would be hip impingement, okay, or pain on the front part of the hip. If you're having hip impingement, the tall tale signs are pain on the front of the hip. So this would be like if you're doing like a lot of squats and you're going like ass to grass, or you're going into deeper squats, you'll feel like a pinch or pain on the front part of your hips. Another classic sign of this is if you're sitting for long periods of time and you go to stand up and you're like, oh, it kind of it takes, you can't fully stand up straight. You kind of hunched over for a little bit, but over time, over a like course of just a few minutes, you're able to stand upright. But you're noticing like you have to hunch over. That's because the hip flexors are tight and kind of pulling you back down forward. Okay, and the reason for that, this one's got a little bit more difficult explanation, but bear with me. So we have the head of the femur. Okay, and then we have our joint capsule of our hip. Okay, and this head of the femur sits in that joint capsule. Okay, the head of the femur is just your upper thigh bone. So this is a position as if I was standing upright. However, if I go into a seated position, now I'm here. Okay, we have our hip flexor. It's a muscle on the front part of the hip that attaches at the front part of the hip, and then also at the lower spine as well. And it comes down and attaches at the femur. So if we are in a sitting position, that means we are also putting that hip flexor muscle in a shortened position. So if we spend hours and hours and hours like this with that hip flexor in a shortened position, when we go to stand up, it takes a little bit of time for that hip flexor to lengthen. And on top of that, it can also change the orientation of your pelvis, even when you go into standing. Okay, the reason for that is, again, that part of the hip flexor is attached at the pelvis. It's also attached at the low back. So what happens if it gets really tight and you go into standing position? What it's going to actually do is change the orientation of your pelvis. It's going to pull you forward like this. So the next time you go into a squat or do a deep squat, now as you go in that squat position, now you're getting some pinching because it's hitting the front part of that pelvis. Okay, so if we shorten up if we do some stretching of the hip flexor and get the glute activation on this backside here, we can start getting that orientation where that pelvis needs to be. And now when we do a deep squat, we're not getting that pinching, okay? Because the hip flexor is tight, it's gonna pull it down, and we're gonna get pinching in the front part of the pelvis much earlier than we normally would if we had normal positioning. Okay. So again, I don't want you guys, this isn't, this workshop isn't, I don't want you guys to self-diagnose yourself. I'm just giving you guys very generalistic things that we see a lot with regards to posture related issues. I encourage you to get, before you self-diagnose yourself, because what people do is they self-diagnose themselves, and guess what? Next thing they turn to is Google WebMD and YouTube and going down that rabbit hole. And the next thing they're searching for on YouTube is best exercises for hip impingement, or best exercises for low back pain, or best exercises for shoulder impingement. And the thing is, just like I mentioned with the shoulder, okay, there's a lot of different causes for shoulder impingement. Is shoulder impingement caused just by rounding of the mid back? No, it can be caused by a lot of different things. And like I mentioned before, just because somebody's having pain on the front part of that shoulder and having shoulder impingement doesn't necessarily mean it's coming from the shoulder. I mentioned a lot of times it's coming from the mid back. So what happens, the problem with searching on YouTube for best exercises for X, Y, and Z body part is there's a lot of other underlying root issues of what's causing it. And a lot of times I see it all the time. Patients actually, before they come and see us, it was actually making the problem worse. So make sure you get an accurate diagnosis done by a medical professional before barking up the wrong tree and spending too much time on it or making things worse as well. So a little bit of disclaimer there, but generally this is what we see a lot of, okay, with people that are sitting quite a bit throughout the day and having less than ideal ergonomic setups, okay? So that's the background. Hopefully that all makes sense, guys. If you have questions, just let me know on that. But I want to kind of dive into things right away, an exercise that you guys can do at your desk that are going to be beneficial, okay? So the first thing I want to touch on is actually for the low back. And this is something that you can just do from in a seated position, okay? And so you don't have to be getting up from your desk and taking a break from work or anything like that. So what I want you to do is, I'm actually on my couch here. So what I'm gonna have you guys do is you're going to actually just sit, okay? Sit upright. And what you're gonna do is you're gonna place your hands on your hips. And from there, what you're gonna do is you're going to arch your low back as much as possible. And then you're gonna round it out as much as possible. Extend, round, okay? Go nice and slow and controlled with this. Shouldn't be painful. So what we're doing is we're just working on getting that extension in the low back again and up in the thoracic spine, okay? And we're starting to help lubricate those spinal segments, okay? When we sit for long periods of time and don't move our low back gets stiff, and we don't have lubrication of the joints, and so joints can get painful. So just by doing about 10, you want to do about 10 repetitions of this, okay? But if you're sitting for an hour, you should be at least doing this at least once an hour, ideally once every half hour, okay? Just do 10 reps, super easy. Shouldn't be painful, okay? Should almost feel good, okay? So that's something you can do for the low back and to start getting some relief there right off the bat, okay? Next thing, okay? You can also do a bias with the thoracic spine. So you can focus, like the last one was focused on the low back. You can also do it where you're focusing on looking up, okay? Rounding out the mid back, looking up, arching that mid back, squeezing the shoulder blades, sticking out that chest, coming back forward. Okay, the great thing about all of these exercises, guys, is you can do this in a seated position. Okay, so the spine, again, you want to do about 10 repetitions of this. Again, none of these exercises should be painful. So the spine itself doesn't just move in flexion extension, it also moves in rotation. Okay, so you need to be proficient there as well. So let's do about 2 more repetitions here, and then I'm going to give you guys some exercises that you guys can do. So right now we're just focusing on flexion extension. We need to start focusing on and lubricating the joint in rotation. Okay, because the spine doesn't just move forward and back. We also rotate and side bend and stuff like that too. Okay, so what you're going to do is you are going to sit up upright. From there, you're going to place your hands out in front of you. Okay, and what you're going to do is you are going to do, it's called a sitting open book. Okay, kind of like it's like book that's opening. Okay, you're here, and then you are following with your neck. You are following that moving arm. This arm should be staying stationary. Your hips shouldn't be moving a whole lot. Okay, we want to be, what we're trying to do is we're trying to cause rotation at the mid back and the low back. So if we get rotation at the hips too much, then we're not getting as much rotation at the low back and the mid back. So make sure you keep your hips positioned. Don't move your knees or anything like that. We're just trying to get movement at that mid back and the low back, okay? Make sure that you're following, your neck and your head is following that moving arm. What I see a lot of people do is they just try and do this. You're not going to get as much mobilization out of this, okay? You need to make sure that your neck is turning as well, okay? And we're gonna do the other way. You can do about 10 repetitions each direction. One interesting thing that you guys can do, and I want you guys to make note on, is noticing if you're able to go further on one side than the other, okay? Little insight here, physical therapists aren't perfect either. So if you guys notice, I'm actually a little bit more, I can feel a little bit more limitation turning to my left here, okay? So make note on if there's some imbalances, because it could be, if you're having pain, it could be contributing to it. Okay, and also going to show you that you're at a higher risk for injury as well. Okay, so we worked on flexion and extension of the low back as well as the mid back, same with rotation of the mid back and the low back as well. Okay, by just doing those simple movements, not gonna lie, I said for every patient that comes in with low back pain, I give them these, especially if they're sitting quite a bit throughout the day, 9 times out of 10, when I give a patient these exact exercises, their pain is halved by the time that they come in, just by doing these exact exercises. Is the root issue solved? No, but they're able to go throughout their workday with a significant amount of less pain. Okay, they're very simple, very basic. It takes consistency. Okay, but if you just do these that I gave you guys just now, you didn't even have to get up from your desk. It's something that's super easy. No offense, but nobody really has an excuse not to do it. It's not like you have to get up on the ground, anything like that. You literally can do this while you're working, while you're typing, okay, while you're working, or just sitting there, okay? Very easy to integrate, all right? So that's a routine that you guys can do at your desk. What I want you, if you guys have a foam roller, what I want you guys to do next is go ahead and grab that. I'm gonna show you guys another few exercises that are gonna be great if you are having some shoulder impingement or pain on the front, or noticing that you're hunching over a lot or slouching a lot, especially on the upper portion of the body, okay? So let's see if I can move this around a little bit better, okay? So, like I said, go ahead and grab that foam roller. What you're gonna do is you're going to go ahead and place that horizontal with your body. What you're gonna do next is you're gonna go ahead and lay down on that. Okay, you want to position it right about where your shoulder blades are. Okay, knees are bent, feet flat on the ground. And what you're gonna do is you're gonna support your head, contract your core a little bit, and then from there, you're going to extend over the top of it. Okay, so guess what movement this is? We're doing thoracic extension. Okay, when we are sitting for long periods of time in poor posture, we're kind of usually in this flex position. So what we need to do is the opposite motion of that. Okay, so we're going into extension. Let your mid back just fold over the top of that foam roller. You may get a few pops or cracks. If anybody's been to a chiropractor before, they usually crack your back, and you'll get some cavitations and pops. You may get a little bit with this. It shouldn't be painful. Might actually feel good. If you get some cavitations, that's totally fine. Okay. And what you're gonna do is you're just gonna fold over the top of it and come back up, back down. You can also kind of move around. Okay, and travel up the back. Ideally, you want to stay within the top of the shoulder blade down to the bottom of the shoulder blade. You don't want to be moving up too much higher or lower than that. You're not going to hurt yourself. It's just you're not mobilizing the segments that we're trying to get with this exercise. Okay, this should feel really good. You hold for about 3 seconds at the bottom here, and then you can kind of come back up. You don't need to do a full sit up. Just kind of come in that neutral position and fold back over. Another exercise that's great for this is if you're noticing a lot of tightness, a lot of in the pecs. So if we're rounded out, our shoulders are pinched forward, a lot of times those pecs get really tight. So what you can do to open that up is, instead of supporting your head back here, you're going to take your arms and you are going to fold over the top of this into a Y position. Okay, you should feel a pretty decent stretch in the pecs. You may also feel a little bit more intense mobilization of that thoracic spine as well. Okay. Again, you can do about 10 repetitions here. Just fold over the top. Try and decrease how much motion you're getting at the low back. Okay, we don't want to like flare the ribs. Like you guys see how much arching I'm getting at the low back now. That's going to take away how much mobilization I'm getting at the thoracic or the mid back. Okay, so try and keep the rib cage pulled down and the core engaged a little bit, and then fold over the top. And you guys can just hang out here. You don't have to do just like 3 seconds. You could literally just hang out here for about 30 seconds. Okay, and come back up. Again, none of these exercises should be painful. If you're having pain with any of these, discontinue. Okay. All right. So that's the thoracic mobilization. I want to give you guys something for the hip flexor to decrease that. Okay. And this is an exercise or stretch that I see a lot of people butcher. So what you're going to do is you're actually going to use this foam roller for balance. Okay. What you're going to do is you are actually going to go ahead and let's start with the left leg up. So what we're doing now is we're stretching this right hip flexor. Okay. So again, you guys could use like a pillow to place under that knee. All right. Especially if you're having knee pain, that's good to put a pillow underneath. Okay. Use the foam roller for balance. What you're going to do is first of all, we're stretching the right hip flexor. Okay. So we've got a right knee down, left leg up, 90 degrees. You guys can see 90 degrees on the front, 90 degrees here, 90 degrees in the back. What we're going to do next, as you guys saw in that diagram, well, my poor diagram with just my hand figures, but you guys saw that on that front part, we had the hip flexor. On the back side, we have our glute. So we can intensify the stretch by contracting our glute and pulling that hip back. What you guys do is contract that glute, squeeze it, all right, and then pull that rib cage down, and then just shift your hips forward slightly, and you should feel a nice stretch here. If your quads are really tight, you may feel a little bit lower. That's okay. Okay, it's going to hit whatever structure needs it the most. What I see a lot of people do incorrectly is they don't contract their glute. They're letting their rib cage flare, and then they're like leaning into it, like I don't feel it. Yeah, well, the reason you're feeling it is because you're not doing it correctly, right? So make sure you're squeezing the right glute, whatever knees down, pulling that rib cage down, and then leaning forward. Okay, and holding for 30 seconds, doing 3 sets of that. Okay, for time purposes, I'm not going to do all 3 sets. Okay, then what you do is you can do 30 seconds on one side, give that side a break, and then switch over and do the same exact thing on the other side as well. Okay. Again, squeezing, so my left knee's down, so I'm squeezing my left glute, pulling my rib cage down, shifting my hips forward, and should feel a nice stretch in the front of the hip flexor there. Okay. Again, you can use the pillow or something soft underneath the knees if you're having any knee pain with that as well. Okay. So I don't want to overwhelm you guys with a whole bunch of exercises because to be honest, if you guys are consistent with, what did I show you, about 5 or 6? If you are consistent with these 5, it's really the low-hanging fruit, what's going to get you feeling better. And I mean, I can give you like 50 exercises if you really want me to, but they're not going to be the more variety I give you guys with that and more exercise I give you, the less focused it is. So capitalize on these 5 exercises. Okay, to recap, it's the extension of the low back. Okay, rounding, we call these the cat cows. Okay, rounding out at the mid back, extension, same thing with the low back and mid back. The open books. Okay, and then the foam roller one, where you're laying on your back. Okay, and putting your hands behind your back, folding over. You can also progress that one and go into that Y position, and then the hip flexor stretch. Okay, with the knee down, in that half kneeling position. Okay, so big thing is if you're dealing with an injury, first of all, disclaimer, these exercises are definitely going to make you feel better. Okay, I can't guarantee that they're going to be solving the root issue. Big thing is, big takeaway I want you guys to take away from this is you need to figure out, why are these tissues getting so tight in the first place? Is it because of your ergonomics? Is it the way that you're sitting throughout the day? Is it the way that you're training, or the way that you're working out? Is it the programming? You know, are you neglecting certain areas? Are you creating imbalances? Is it the way that you're walking, running, moving, your movement patterns in general, as well? So really get to the root cause of what's going on, and so this doesn't have to be something that you have to do, you know, forever, right? So the question I get from a lot of my patients on, you know, do I have to do these exercises the rest of my life? I'm like, well, it depends. Are you just going to do stretching and foam rolling and being reactive to the issue? Then yeah, you're going to have to do these quite frequently. However, if you treat the root issue, is it the positioning, the way that you're moving, your imbalances, strengthening up weak muscles that are causing these problems as well, and correcting that. If you correct those are much longer lasting changes, and you don't have to be so reactive to it. The improvements are going to be much longer lasting, and a lot of times indefinitely with that too. So you don't have to be constantly reactive to using by turning to foam rolling and stretching and all that too. Okay. So hope this was beneficial, guys. Again, make sure that you seek out a medical professional, whether it's us, another physical therapist, chiropractor, massage therapist, your physician, or anything like that. Main thing is, I tell people this all the time: if you go to a practitioner and you tell them that you're having pain with running, you're having pain with squats, or you're having pain with deadlifts, and they tell you, "Oh, well, if you're having pain with it, just stop doing it." Go get another second opinion, okay? Because there is somebody out there that can help you and get you back to the activities that you want to be doing, and you don't have to be avoiding these exercises. And a lot of times when patients come in, uh, the big thing is we can get them back to about 95% of their workout routine that they want to be doing right there on that first session, because we're able to make modifications to the exercise that they're doing in the meantime while they go through the rehab process uh, and whatnot too. So again, hopefully you guys found this helpful, and if you guys have any questions, I'm more than happy to help. All right, thanks.